Has it ever crossed your mind how a tiny pill can make such a huge difference in your health? This question might seem simple, but the answer is deeply rooted in the fascinating field of pharmacology. Pharmacology, in its essence, is the study of drugs and their effects on the human body. It's a vast and intricate science, exploring everything from the molecular makeup of medicines to the body's response to different substances. For those of you in the nursing field, pharmacology takes on even greater significance. You see, as future nurses, you will be the ones administering these drugs to patients. Understanding pharmacology helps you predict how these drugs will interact with the body, enabling you to provide better care to your patients. It's like having a roadmap to guide you through the complex journey of patient care. Now that we have an idea what pharmacology is, we dive into its fascinating subtopics. Ever wondered how drugs work in your body? That's what we call pharmacodynamics. Pharmacodynamics, in essence, is the study of how drugs interact with our bodies to produce specific effects. It's like a dance between the drug and the body, where the drug is the dancer and the body is the dance floor. The drug, or dancer, interacts with the body or dance floor to create a unique performance, or effect. Let's break it down a bit. All drugs are chemicals, and these chemicals interact with our body's cells. They may either stimulate or inhibit normal cell functions, leading to the desired therapeutic effects. These drug-cell interactions can be incredibly complex, involving processes such as binding to receptors, blocking enzymes, or even altering DNA. For instance, let's consider how pain relievers work. They typically block the production of certain chemicals in your body that cause pain. So the drug is essentially telling your body, hey, let's take a break from making those pain-causing chemicals. And voila, you feel less pain. But why is understanding pharmacodynamics so crucial, you may ask? Well, it's vital for ensuring patient safety. By understanding how a drug interacts with the body, healthcare professionals can predict its effects, anticipate potential side effects, and adjust dosages accordingly. For example, if a drug is known to lower blood pressure, a healthcare professional would be cautious about administering it to a patient who already has low blood pressure. They might choose a different drug, or adjust the dosage to avoid causing further harm. So imagine pharmacodynamics as a key part of the puzzle that helps us understand the full picture of a drug's effect. Without this knowledge, we would be prescribing and administering drugs blindly, which could lead to harmful consequences. In conclusion, pharmacodynamics is not just about understanding what the drug does to the body, it's about ensuring that the dance between the drug and the body results in a performance that is beneficial and safe for the patient. So pharmacodynamics is the science of what drugs do to our bodies, but what about what our bodies do to the drugs? Now, we flip the coin and look at what our bodies do to drugs. Welcome to the world of pharmacokinetics. In this fascinating realm, 4 primary processes determine the journey of a drug in our bodies: absorption, distribution, metabolism, and excretion. Together, these processes paint a picture of how a drug behaves, how it's used, and how it leaves our body, all of which can greatly affect a drug's efficacy and safety. First up, absorption. This is the process where the drug moves from its site of administration into our bloodstream. It's like a ticket to ride the body's circulatory system, and how fast or slow it gets absorbed can depend on the drug's form, the route of administration, and the individual's physiological condition. Next, we have distribution. Once the drug is in the bloodstream, it's off to the races, traveling to different parts of the body. The distribution of a drug is influenced by blood flow, the permeability of cells, and the drug's affinity for different tissues. It's like a sightseeing tour, with the drug visiting various bodily sites. Thirdly, we have metabolism. This is the body's way of breaking down the drug, usually in the liver, to make it more water-soluble so it can be easily excreted. However, this isn't always beneficial. Sometimes the metabolic process can convert a drug into a more active or toxic form. Finally, there's excretion. This is the final act of the drug's journey, where it's removed from the body, typically via the kidneys. However, some drugs can be excreted in other ways, such as through sweat, breath, or breast milk. But remember, these processes don't operate in isolation. They interact and influence each other, and variations can occur due to factors like age, genetic makeup, disease state, and even diet. Pharmacokinetics teaches us that our bodies are not just passive recipients of drugs, but active participants in their effects. So as we delve deeper into pharmacology, let's remember to give our bodies the credit they deserve for their role in this intricate dance of drug action and reaction. Did you know there are thousands of drugs out there? But don't worry, we have a system to make sense of them all. Welcome to the world of drug classifications. It's like an intricate map, guiding us through the vast landscape of pharmacology. Each drug is assigned to a class based on its therapeutic use and mechanism of action. This means drugs are grouped according to what they do and how they do it. Let's take an example. Think of the class of drugs known as antihypertensives. These are medications used to treat high blood pressure. This is their therapeutic use. But within this class, we have subcategories based on their mechanisms of action. Some antihypertensives, like ACE inhibitors, work by relaxing blood vessels, while others, like diuretics, reduce fluid in the body to lower blood pressure. Now, why is this important? Well, understanding drug classifications is crucial for safe and effective nursing practice. It helps us predict how a drug will behave in the body, anticipate potential side effects, and understand interactions with other drugs. Knowing the drug classes also aids in patient education. It allows us to explain to patients why they're taking a certain medication and what they can expect from it. This can greatly improve patient compliance and overall health outcomes. But remember, while drug classifications provide a general idea about a drug's properties, each drug is unique. Even drugs within the same class can have different effects or side effects. So it's important to always refer to reliable resources when learning about a specific drug. And one last thing, drug classifications aren't set in stone. As we continue to learn and discover more about drugs and how they work, classifications can change. It's like the map of pharmacology is always being updated. So keep exploring, keep questioning, and keep learning. It's a vast, fascinating world out there, and understanding drug classifications is the compass that guides us through it. Understanding drug classifications helps us navigate the vast world of pharmacology. So, how does all this theory translate into practice? Let's see how pharmacology fits into nursing. Well, one of the most important roles a nurse plays is educating patients. This goes beyond explaining what a medication does. It's about translating complex pharmacological concepts into something patients can understand. For instance, knowing the pharmacodynamics of a drug allows a nurse to explain not just that a medication lowers blood pressure, but how it achieves this and why it's important. This knowledge can help patients understand the importance of taking their medication regularly and correctly, which in turn can increase adherence to treatment plans. Likewise, an understanding of pharmacokinetics is crucial in medication administration. Nurses are often the ones physically giving medications to patients, and they need to know how these drugs are absorbed, distributed, metabolized, and excreted by the body. This understanding can influence the timing of medication administration, dosage adjustments, and can help predict potential drug interactions. For example, if a drug is metabolized in the liver, a nurse might need to adjust the dose for a patient with liver disease or be aware of potential interactions with other medications that are also metabolized in the liver. Monitoring patient responses, another key nursing responsibility, is also deeply rooted in pharmacology. By understanding the expected pharmacological response of a drug, nurses can accurately assess whether a medication is working as intended. Additionally, they can look out for potential side effects or adverse reactions. If a patient taking a new medication for depression starts feeling unusually drowsy, a nurse with a solid understanding of pharmacology would know that this could be an adverse effect of the medication and would take appropriate action. As you can see, pharmacology is integral to nursing. It enhances patient care and safety. It's not just about memorizing drug names or doses, it's about understanding how these medications work and how they can impact our patients. It's about making informed decisions, providing quality care, and ultimately keeping our patients safe. We've covered a lot today, so let's recap. We started our journey by defining pharmacology as the study of how drugs interact with the human body. We then dove into the world of pharmacodynamics, exploring how drugs produce their effects. From there, we ventured into pharmacokinetics, understanding how the body processes these drugs. We also delved into the myriad of drug classifications, highlighting how each class of drug has its unique characteristics and effects. And of course, we discussed the pivotal role of pharmacology in nursing practice. It's not just about knowing what drugs do, but also about understanding how this knowledge can be applied to improve patient care. In essence, we've seen that pharmacology is a complex yet fascinating field that is integral to the nursing profession. Remember, understanding pharmacology is not just about memorizing drugs. It's about knowing how to use this knowledge to improve patient care. Stay curious, future nurses.